Hello, people of the world. This is the Open Pulpit again, and we welcome you to partake in what we call a very interesting conversation, something that is relevant to us at this time, something that has affected everybody all over the world, something that even presidents of nations have problem handling. I'm talking about the coronavirus and its vaccination treatment. To the glory of God, we have experts here today who will help us discuss the socio-cultural effect, the medical effect, and spiritual effect of coronavirus all over the world. I'm going to ask our panelists to introduce themselves one by one. I'm inviting Dr. Laja Ibraheem to introduce himself first. Over to you, sir.
Yes, thank you, Pastor Fafora, for inviting me to this forum. I'm a board certified adult and geriatric psychiatrist here in California. I'm in private practice. I've been practicing for 20 years.
Wow.
And also have, I'm also a research scientist involved in some research, and I'm assistant professor at Ross University.
Amen.
Thank you.
Thank you so much. You're welcome. You're welcome. Madam Stella Kpaduwa, can you please go ahead and introduce yourself?
Good day, everybody. My name is Dr. Stella Kpaduwa. I'm a pediatrician, and I'm in private practice. I've been in practice as a pediatrician for 24 years.
Amen.
And currently, I'm the chairman of the Association of Nigerian Physicians in Americas, Southern California chapter. It is really a pleasure to be here today.
Thank you, Doctor. God bless you. Very good. Now, Dr. Ogunshakin, over to you, sir.
Thank you very much, Pastor. It is a pleasure to be here to join you in this conversation. My name is Mobolaji Ogunshakin. I'm a fellowship-trained infectious disease physician who has been in practice for the last 24 years. I'm currently practicing in Warner Robins, Georgia, in central Georgia. I'm actively involved in the management of patients with COVID-19. I have been taking care of patients with multiple infectious diseases, including HIV, for many, many years. So I'm happy to be here to contribute to this conversation.
Thank you so much, my brother. Madam VP, sister, please, over to you.
Good morning, everybody from California. My name is Lara Okunubi. I'm an entrepreneur, and I'm also a community activist and advocate. So I'm happy to be here.
Thank you so much. People of the world, you could see that we have a great panel today. The resumes are very, very impressive. So I'm looking forward to getting a lot. Let's begin with Dr. Ogunshakin. Sir, can you discuss for about 3 minutes the benefits of the vaccine?
The COVID-19 pandemic, which came to the United States in January 2020, has devastated a lot of people. From January 3rd, 2020 to now, May 7, 2021, organization has figures of 32,210,817 cases in the United States alone. That is more than 32 million. You know, and in the last 24 hours, there have been 42,000 new cases. And the number of deaths is 573,722 in the US alone. And in the last 24 hours, 736 people have died from COVID-19. So this is a pandemic. It is an infection that is present in multiple countries all over the world. It is very important to stop this pandemic and prevent further deaths. And the best way to do that, in addition to the precautions that have been given, is by vaccination. Fortunately, by the grace of God, a vaccine was developed to COVID-19. Now, I interact with patients every day, those who are sick and those who are not sick. Those people that have COVID, when they get really sick, they get very sick. They can't breathe, they have fever, shortness of breath, and a lot of them even end up on ventilators, and some of them actually die. Now, what is the vaccine? The vaccine is a method for preventing the infection. A lot of people are not very clear how this vaccine works. Now, there are several categories of vaccine. There's the Moderna vaccine, there's the Pfizer vaccine, there's the Johnson & Johnson vaccine, and then there's the AstraZeneca vaccine, which is used in the UK as well as in Nigeria. Here in the United States, we are using 3 vaccines: the Moderna vaccine, the Pfizer vaccine, and the Johnson & Johnson vaccine. Now, the Moderna vaccine and the Pfizer vaccine, they're in the same category. They were produced in the same way. Now, some people are concerned by the fact that they said that these vaccines were produced very, very quickly, too quickly. And they are worried about the fact that not enough research, not enough testing has been done on this vaccine. But I want to let you know that the technology that produced the vaccines has been in development for the last 20 years.
Wow.
Scientists in Pennsylvania were working on this technology in the last 20 years. So it's not something new. They've been working on this technology, and by the grace of God, they were successful in developing it right just in time to utilize it and make a vaccine against the coronavirus. So testing has been ongoing for 20 years. So this is not something new. The vaccines are extremely effective, and we need to know that they are actually safe too. They were tested significantly before they were deployed. The Moderna vaccine is available to be used in people who are 18 years and older. It's 2 doses, 28 days apart, and it gives you 94% efficacy in preventing serious disease, 94%. The Pfizer vaccine is available for people 16 years and older in 2 doses, 21 days apart, and it gives 95% efficacy. Now, recently, more research is being done in younger people, teenagers 12 to 15 years old. Pfizer has done clinical trials of the vaccine in teenagers 12 to 15 years old, and it's been shown to be safe. So FDA is going to give emergency use authorization any day now.
Thank you, sir. Let me just, Doctor, thank you so much. Let me just interrupt you briefly. I'm coming back to you with 1 or 2 questions, but you've quoted some impressive statistics, which are frightening in a way, but that's the reality of our situation. So I want to ask Dr. Ibraheem to talk briefly on the stress, the mental and psychological effects of the consequence of coronavirus. Dr. Ogunshaki, I'm going to come back to you to ask 1 or 2 relevant questions that are technical. And then tell him, Dr. Ibraheem, over to you, sir.
This is an unprecedented time. And this is something that is not being talked about much in terms of the emotional toll and the emotional impact of this pandemic. As you all know, we haven't dealt with situations like this in almost 100 years. The last time we had a pandemic like this was the Spanish flu almost about 100 years ago. There was kind of like a mass hysteria, both from the government and from the population. And then we had a lockdown. People were just scrambling. How do we handle this situation? And then, the emotional toll of people being locked down, people being isolated, created what we call the traumatic stress, but also on the vulnerable population. People have pre-existing mental health conditions. People like my sister who deal with people who are developmentally disabled, who have all kinds of problems, elderly people especially, people who have dementia. So this causes a lot of anxiety, panic, social isolation, which exacerbate their underlying condition. And for people who do not have those conditions before, because people have all kinds of resilience, it creates new problems. People develop, we've seen a lot of people with anxiety, panic attacks, depression, some people even to the extent of suicide. And then that is a lot of impact on our healthcare system. The other group of people that are not being talked about are healthcare workers, frontline workers. Some of them have not had to deal with this kind of situation, pressure. You know, a lot of people have been traumatized by seeing so many people dying on a daily basis. And then what's the other issue that we have on our children and young adults, school-age children who have been cut off from their friends, they cannot go to school and all of that. Then on families at home, having to have children at home, people are caregivers or cannot, their caregivers don't have outlets where they're able to go to deal with them on a daily basis. The other thing that is not being talked about is grief, loss of income, loss of jobs, loss of families. That creates a lot of emotional toll. So it's multifaceted. And then on the vulnerable population, which is something we need to talk about, especially the African-American population, who have been impacted more than the white population on this. Wait
a minute, sir. You're talking about African-Americans, or we want to talk about also Black people all over the world, or just Afro-Americans?
Well, you know, in our context here, you know, we could talk about African-Americans and Africans. Okay. And we need to know why are we impacted more than other people, and then the extra emotional turmoil impact of those on those populations. So we are part of the vulnerable populations, including the elderly people. So the mental health impact of this is very significant, and it's something that has not really been talked about. And this is part of the things. The traumatic stress is part of what creates what we have as vaccine hesitancy and all this conspiracy theory.
So in a short word, it means then that a lot of people, they can discover that they have changes in their personality, in their outlook towards life, etc. That's very interesting.
Exactly.
When you were talking, sir, you briefly mentioned the effect on the children, you mentioned their school. May I invite my sister, Dr. Kpaduwa, to talk about the effects of the pandemic and vaccination and infection on our children and their school life, their growth at home, and the community?
Yes. Yes, thank you very much. Well, in terms of the children, it has really been difficult to obtain accurate number of the infection rate in children, because most of the time they don't show any symptoms. And it's when they actually get exposed to somebody else who has the infection, especially the parents, that is when we begin to check them. As of April this year, about 3.78 million children have tested positive since the onset of the pandemic. Severe illness in children is rare. About 0.1 to 1.9, about 2% of these children are hospitalized, and the death rate is very minimal. It's about 0.3%.
Wow, fantastic.
Most states don't even have any deaths to record.
Of children.
So as you can see, children have really done well with this epidemics. And that is why initially they were saying, oh, children are okay, they don't get infected. But they do get infected. And the problem with this is that, like I said, most children are asymptomatic, and when they do have the illness, it's very vague. Most of them come out, oh, I have a headache, I have a cold, I can't eat. And then you begin to scramble and say, okay, why? Because of the pandemics, they get tested. And most of the time, they get the infection from their parents. From my experience, most of them are getting their infection from the parents. The parents test positive, and then you want to test the children too. and you find out that they are positive, but they handle the infection very well. Most of them.
That's good news.
They handle the infection very well. Also, people wonder about pregnant women when they have children. We've dealt with a lot of pregnant women, and they have these children. The children get tested, and they are fine, and they are still allowed to breastfeed, wash their hands, don't kiss the baby, and things like that. And the children have done well. I've had a 6-month-old baby that was positive. He got it from the mother. And what we did for that child, the child was just having like cold symptoms. But we admitted this child, and the child did very well and came out of the hospital. So far, children have fed well during these pandemics. But then we still emphasize that you have to wear their mask, hand hygiene, and social distancing. The mental effect on these children, because they are home, they are doing the Zoom classes, and when you see a lot of them, they're really not happy. They don't concentrate. And it's really particularly hard on the children who are mentally challenged. And you find out that they're not focusing because they're not in the right setup. The mothers are frustrated, the children are frustrated. But with the new vaccines, with the vaccines we have, things are much better.
Thank God for that.
Yes, we found out that even with the introduction of the vaccine, the infection rate in the children has gone down, and now they've gone back to school. They're now going to school like 2 or 3 days in a week, which is good.
At the risk of sounding spiritual, I want to say that God has a special place in his heart for children generally. Maybe that's why it's been possible for them to handle it well more than adults. Let's quickly talk to Dr. Madam VP, my sister Lara. I'm sure you must have an idea, an opinion about the socio-cultural effect of the pandemics on humanity, so to say. What are your views, ma'am?
Well, thank you for that question. I'm an employer of Neighbor, and I have more than 82 employees, so with diverse cultural background. So I do get different feedback, different theories, different opinions. This is a country where data speaks. You have to look at the data. And when you're talking about data, according to the CDC website, more than 340 Caucasians died of COVID-19. About 83,000 of Black Americans, Black in general, whether you're American or Nigerian
African or whatever.
Yes, Africans, yes. About 83,000 of them died of COVID. And Hispanic community was about 104,000, close to 105,000. So you can see you can see the gap or the differences in different culture. So relatively, when the vaccine was being distributed, right now about 60% of Caucasians have gotten the vaccine, and compared to 15% of the Black and Brown community, which is Black and Hispanic. So it's not about the disparity, because we keep shouting race, we keep shouting all of those things. And it's not for lack of vaccine either. It's for lack of education, which is why this forum is really important. People are not educating themselves and they're not getting the right information. Instead, they're forming opinion based on what is shared at the barbershop, at the hair salon, at the nail salon. You need to get the fact. You need to equip yourself with the fact. So as far as I'm concerned, the community needs to heal. And in order for us to come back together, whether in church settings, whether in social gathering settings, whether at work settings, we all need to be well. And part of getting there is this vaccine.
Thank you so much, Madam VP. We also need to be disciplined, because a lot of people are complaining about the shutdown, about having to wear face masks. A lady told me something that's very ridiculous. She said she's not happy that she's not able to put on lipsticks, the mask and things like that. You know, how ridiculous can people get Dr. Ogunshaki, I'm coming back to you, sir. DNA is a key factor of human physiology, so to say. Is it possible for coronavirus to change somebody's DNA?
Categorically, no. That is not possible. Categorically, no. That is one of the things that has been causing fear in the community. Actually, a lot of people think that the vaccine is going to change their DNA. That is not going to happen. That doesn't happen.
Amen.
Your DNA is contained in your nucleus of your cells. The vaccine does not enter the nucleus of your cells. The vaccine
So which means the rumor that if you take the vaccine now, you may have consequences in about 10, 20 years' time?
That is false. That is completely false. The vaccine doesn't last in your system. The vaccine doesn't enter your nucleus. It doesn't change your DNA. It will not affect you, not stop you from having children. Those are all false rumors. They're myths. And people need to know that that is not going to happen, because a lot of people are thinking that.
Amen. One other question. Sorry, I'm taking you on so many questions. After vaccination, Dr. Ogunshaki, can you still get COVID infection?
Yes, because you will remember that when these vaccines were developed, the companies specified that the vaccines are designed to prevent severe disease and death. You can still get infected, but you will not have severe disease. You will have a mild disease. In a vast majority of cases, the vaccine will protect you from getting infected, but if you do get infected, you will not get very sick. You won't be admitted in the hospital and be on a ventilator. So the vaccines are very, very effective in preventing severe disease. Severe disease is what we are really concerned about. People that get COVID and have a mild disease and recover spontaneously, they are not the problem. The problem is those people who get really sick, get admitted in the hospital, get put on ventilators, and die. So the vaccines are very effective in preventing severe disease.
Thank you so much. Then my next question is very simple. It's a layman's question. How long does COVID vaccine, for how long can COVID vaccine protect us against this disease you are talking about? I mean, we took it twice. We took first shot, and then a few weeks later, 3 weeks later, we take second shot. Are we looking to having to take shots in about 5, 10 years time, or that's it?
These vaccines have been deployed for 6 months or a little bit more than that. So the data that we have is only 6 months old. We know that people who got the vaccine 6 months ago still have protective antibodies. So the Pfizer and the Moderna vaccine, we know that even up to 6 months, there's protection. As time goes on, we will continue to monitor the situation, and that would tell us how long the protection will last. But it is possible that we may have to give people a booster vaccine as time goes along the line, because the immunity may start to wane. That is why, flu vaccine, we get it every year, So it is possible that as long as this pandemic is going on, people will need to get booster shots of the COVID vaccine.
Thank you, sir. Thank you. Dr. Kpaduwa, let me come to you. When you were speaking ab initio, you said that, children can take COVID vaccine. Yes?
Yes.
Can pregnant women whose pregnancy are at advanced stage also take COVID vaccine?
Yes.
Without any effect on the children?
Yes, they can take the vaccine.
Okay. Thank you so much. I appreciate that. Now the question is, what is the historical impetus for vaccine hesitancy? Why were people, hesitant to take this infection? For example, I must confess that when it started, I didn't want to take the vaccine because I felt that if it's not spoiled, why fix it? I see myself as being a very good health, and I'm not scared of what people are talking about. I just felt that, why should I put one poison into my body when there's nothing wrong with me? Can somebody discuss why were people hesitant in the first instance?
I think one of the recommendations, according to the American Psychiatric Association, they talk about this pandemic, is to make sure that you get the right information from the right source. And I think that is what created problem from the onset. Because instead of getting information about the pandemic and what is happening with the pandemic, we were getting information from politicians. And that creates a lot of mixed messages from the onset. So people are getting information from the blogs, from social media, and all kinds of stuff. So that creates a lot of fear and anxiety, and especially for people of color who previously have experienced some, already have some misgivings about what is coming out from the government. It increases their anxiety and their fear, and it creates distrust. And I think that is what's happened from the onset. And that's why we're having a lot of vaccine hesitancy. I mean, I remember, even up until recently, we are having pastors, men of God, who are doing series and talking about the vaccine and, talking to their congregations about, why they should not take the vaccine. And I mean, it's just a mess. And I think that is the main reason reason why there's a lot of vaccine hesitancies. We all heard about what happened with the Tuskegee experiment. That is still there. And a lot of people of color, they are still suffering from the effect of post-traumatic stress disorder. And one of the effects of that is avoidance. One of the symptoms of PTSD is avoidance of things that bring you trauma in the past. So a lot of them are still feeling the effect of that. That how could this happen to us? So they avoid anything that we bring in those trauma again. So I think that those are the things that is causing a lot of vaccine hesitancy.
Thank you for explanation. But Dr. Ogunshakin, can we blame the people? Because people say that scientists are yet to produce vaccine against HIV in decades. So how and why in less than a year they are able to develop a vaccine against COVID? So people suspect that this is a hurriedly put together a solution.
Thank you for that. But let me just say a few words about the last question.
Yes,
a
sir.
lot of African Americans on a daily basis experience discrimination in the healthcare system on a daily basis. They are not treated right. They are not given the right consideration, and their outcomes are poorer than their Caucasian counterparts. So this is a constant, ongoing, daily experience for a lot of African Americans. And as a result of that, a lot of African Americans don't trust the healthcare system. That is part of the origin of the hesitancy, vaccine hesitancy. Now, to go back to your question, sir, the development of the COVID vaccine, like I said, the technology, the mRNA technology has been in development for 20 years. So this is not hurriedly put together. This technology has been in development for 20 years. It just happened that it was directed, it was deployed towards the most urgent need right now.
Okay.
The most urgent need right now is the COVID-19 pandemic. And that is why they directed that technology towards that. That technology is also being used to develop an HIV vaccine. That is in the works also. Several other vaccines against other diseases are being developed using this technology. But the most urgent need right now is COVID-19 pandemic. It is the thing that is killing so many people so rapidly, and that is why it was directed. Because if you have a fire in a neighborhood and 5 houses are burning, you will go, the fire department will attack the biggest fire first.
Yes.
And that's just rational, that's reasonable. You attack the biggest fire first. And right now, COVID-19.
How about the fire of cancer?
There's
cancer that been beat us for a long time, sir.
Cancer research has been ongoing. And in fact, I have a colleague who's a professor of gynecological oncology in Pennsylvania. This mRNA technology was initially directed at the cancer vaccine. That was the first thing that they directed this technology towards, cancer. But the vaccine was not successful. See, it doesn't work for everything. So it has been tried to develop a cancer vaccine and it did not succeed. That was the first thing years ago that they tried this mRNA technology against.
Okay, thank you so much, sir. I want to come to Madam Lara. Should we continue preventive measures, face covering, hand washing, and physical distancing after vaccination? I saw 2 or 3 videos recently in Africa. People seem to, in Nigeria in particular, people seem to disregard COVID-19 as if it's non-existent. They are attending parties, they're dancing up and down, no social distancing, no covering of face, and they are eating together on the same table. Talk to me, Madam Lara, please.
Well, definitely, experience is a core factor in building trust. So the person who has an automobile accident or the person whose spouse died and you don't have life insurance knows the value of life insurance or knows the value of automobile insurance. Those who have lost loved ones, they don't have to be told to wear masks because they've seen it firsthand. It got close to their home. So we need to continue to do what needs to be done to move forward, to close the gap. The economies are being broken down. I mean, the children are living in fear. But our defense, as far as I'm concerned, lies in collective action. And right now, CDC, that is the overriding authority, said, this is what we need to do so that we can have a long-term effect of connecting with each other. So if you fail to do this simple thing, you're going to be reinfecting each other because, like all the specialists have talked about, this COVID vaccine is just a preventative measure. It does not preclude you from getting COVID-19 virus.
It does not prevent you from passing it on to other people.
Exactly. That is the worst part. That is the worst part. You could be a carrier and you continue to infect other people if you're not wearing a mask and doing all the other precautions that have been recommended. That is the scary part. So, yes, we need to continue to do what we need to do so that we can cut down the trajectory of this debilitating condition, so to speak.
Thank you so much. I want to thank you, gentlemen and ladies, or let me be more proper, ladies and gentlemen, so to say. Madam BP, thank you. Dr.
Welcome,
Stella
sir.
Kpaduwa, thank you. Dr. Shaki, you are blessed, thank you. Dr. Ibraheem, I want to end this interesting discussion by giving each one of you a few seconds to give an advice to our people over there before I conclude and round up. I want to start with Dr. Kpaduwa, being the mother of children. What advice do you have for the community in a few seconds? Thank you, ma.
Continue to follow the CDC guidelines, wear your mask, hand hygiene, social distancing, and let the children who qualify to get the vaccines get the vaccines.
Thank you so much.
Now them from 16 and up, 16 years and up, let them get the vaccines.
And pregnant women too to get the vaccine.
The vaccines, yes.
Thank you so much. Dr. Ogushakin, parting word for our people.
It is very hard for people who are focused on survival and they're having a hard time making it financially to think about the possibility of getting a virus they cannot see. But I need to emphasize that if anyone doesn't take the vaccine, they are exposing themselves and their families to severe illness and possibly death.
Wow.
This vaccine is very effective in preventing severe illness and death.
Yes, economic hardship is very difficult. In places like Africa, Nigeria, when people are focused on survival, making ends meet, putting food on the table for their children, it is hard for them sometimes to think about something they cannot see as a danger. But we need to stress that COVID-19 is real. The pandemic is real. It has killed millions of people all over the world. If we continue to refuse to take the vaccine, then we will not reach what we call herd immunity. There will not be enough people vaccinated so that we can stop this pandemic. The theoretical point is 70 to 85% of the population. If we can vaccinate 70 to 85% of the population, we will achieve herd immunity and stop this pandemic. Because so many people are refusing to take the vaccine, this may not happen. Therefore, this pandemic may continue for years and years to come. That is not a good thing because millions more people will die. So it is important for people to take the vaccine to protect themselves, protect their families, protect their children, protect their co-workers. That is very, very important. Thank you
so much. Thank you. Thank you so much. Dr. Ibraheem, what says thou?
Yes, thank you. And my point is to first tell people that emotional problems as a result of this pandemic is real. And for people to begin to recognize it and take care of themselves. Create as much as possible a social support for yourself, because social isolation is dangerous. Take care of yourself, take care of your family, stay healthy, limit your addiction to media, especially now that people are working from home, and check in with your children and your loved one from time to time to see how they are doing emotionally. And just like Dr. Ogushakin said, make sure that you take the vaccine, get information from the right sources. And I want to advise all of us here, we are all community leaders, especially people in the faith community, our pastors. Make sure you give your congregants correct information about this pandemic. Let's get information from the right source. Pastors are not scientists, and let the scientists do their job and give our people the correct information regarding this. It is very mind-boggling to see pastors turning themselves to scientists and giving information that are incorrect. So please listen to the scientists. Thank you.
Thank you so much, Madam VP.
Yeah, for me, I do acknowledge the disparity in the Black community, especially, and I know that trust in the community or trust in the government has reached, unfortunately, a historic low. Nevertheless, in the words of Emma Lazarus, none of us is well until we are all well. We need to start healing. We need to start doing what we have seen as evidence. Wearing your mask, wearing your hand washing, physical distancing, don't social distance, connect with people. There's a difference between social distance, because I think that's where a lot of mental health issues arrive. People just isolated and they're not connecting with others. We all need each other. None of us was created to live a solitary life, but physically distance yourself, because in the event of sneezing, you'll be far apart from the person without, you're passing on what you don't want to pass on. So, and like Dr. Ibraheem said, I hope that leaders in the community will start to give testimonials, particularly those who have taken this vaccine, to encourage and empower other people, to let them know that it is all right and it's going to be all right. Thank you for having me.
Thank you so much. Well, you have listened, you have heard all kinds of discussions from different angles, from different perspectives. Let me quickly allay the fear of Dr. Ibraheem that not all pastors think the way you express so, and that some pastors are actually scientists. I happen to be a structural engineer, scientist, and my wife happens to be an ophthalmologist, a scientist. So we know the importance of the vaccination. And in any case, God gave the knowledge of science for the purpose, for the advantage of men and humanity. So whoever does not take the best advantage of what medicine or science has to offer is doing it at his own peril. So people of the world, my advice to you as a pastor, who is also a scientist, is for us to stay in our lanes and do what is best for us, for our family, and for our congregation. Although I must also mention that there's a spiritual dimension to the problem we have. Because I know that it is not impossible for God to prevent the pandemics to happen. But some of us, men of faith, see it as a warning, a call to discipline, a call for us to understand that however powerful we may be, there's still a supreme being that can control things. And thank God this time around, God has given us knowledgeable scientists, medical doctors who are able to produce this vaccine. So if you refuse to take the vaccine, then you are making a choice to die. And not just making a choice to die, you are making a choice to kill other people before you die. And that's not what the mind of God is concerning us. The mind of God is that we live long. And I pray that we all live long, not in sickness, not in disease, not in sorrow, not in poverty, in the name of Jesus. Amen. So because at this time we need to call this particular discussion to an end, as I thank again our panelists, Dr. Ibraheem, Dr. Ogunshakin, Dr. Kpaduwa, and Madam VP, Omolara Okunubi. God bless you really good. We'll come back to you again. Again, this is the open pulpit where we discuss relevant and practical things for the edification of the children of God all over the world and to glorify His name. You can check us out on YouTube, on Facebook, or on our website, theopenpulpit.org. God bless you. See you soon again.